Hi friends, snoring is a big problem, and of course migraine headache is a big problem. A lot of people are having it. Why does it come and how is it related to the eye? I'm an eye doctor. Yes, both have a very strong link for transient vision loss or complete vision loss. Are you shocked? Yes, it is a recent study which has come out suggesting that headaches, especially retinal migraines and snoring, can cause the blood supply to the optic nerve can reduce uh, because of vasospasm, and this in turn can cause either papilledema and vision loss, or slowly it can cause non-arthritic AION. Anterior ischemic optic neuropathy can be caused, and either a partial visual loss can happen or a complete visual loss also can happen. So, how do we go about? Yes, I know a person who's snoring. What is the next step? Um, I have a person who's got migraine. What is the next step? Yes, we need to do a detailed checkup, and what kind of problem it is. If it is snoring, we have a sleep study equipment which can be given to your home, delivered to your home, and on me getting the data, I can process it and I can tell you what to do next. So CPAP can be applied. So once if you have a vision problem because of these conditions, yes, now there are stem cells to a remedy, along with growth factor concentrates, hyperbaric oxygen therapy. So on and so forth. We have these tablets which can improve the retinal functions. So you need to reach out to us, and please share this video to whomever has got vision problems, snoring, or migraine, and definitely we would be able to help them retain their vision, regain whatever they have lost. Thank you, Dr. Sashi, for Sashi Eye Care and H2O Sashi.